The key things with non-operative management for arthritis in the knee are doing things which can last a long time. You can consider treatment options like a ladder. The safest go-to medication is paracetamol. That has the best safety profile. Often people can take it for a long time and just need to have their liver function checked by their GP. And so the next rung on the ladder after paracetamol is an anti-inflammatory. And because that can have side effects on your kidneys, can cause tummy upsets, blood pressure problems, and that can be good and a good adjunct if you're using it, say, before you go and play golf, or you're doing something which hurts a lot like mowing the lawn. Besides that, there's using things like ice packs and heat packs, and people often ask me, should they use an ice pack or should they use a heat pack? And the answer basically is whichever one helps. So it's all about comfort. You then consider different types of injections because they tend to have less of those systemic side effects of tummy problems, of kidney problems. So that's why we consider PRP or steroid injections if people are needing something extra than the oral tablets. There's lots and lots of talk always about different types of braces. I often think that there's low risk with them. So if anyone wants to try them, then yes, try them. There's different ones which are like made out of wetsuit material, for example. So if it's cold, try that. Some of them get wrinkled up behind your knee and always fall down or can get too sweaty. Try a different type. Some people have benefits of ones which have a cutout on the front for the kneecap. Other people, they don't mind and just have one which is completely closed over with elastic, whichever one you prefer. As well, you can rub anything on it that you want. So some people try different creams that they get from the chemist, different sprays. There's an anti-inflammatory cream that you can rub on the knee as well. So any type of massage basically can be beneficial. There's been a lot of studies done recently where the importance of trying to improve your body weight has been recognised to not only help with their symptoms, which can help then delay surgery, but should they come to a knee replacement, it makes their knee replacement safer. So there's less risk of infection and complications, but it also makes the knee replacement last longer, optimising your BMI, and that's called your body mass index. There are online calculators where you can plug in your weight and plug in your height and get a rough idea of what would be a better weight for your height. But obviously the lighter you are, the less load the knee has to carry. Studies have shown that usually someone has to lose 10% of their body weight before they'll actually experience a benefit. Physiotherapy is very important. We're trying to make sure that the muscles which surround the knee are as strong as possible. People can carry an injury or can be walking with an abnormal gait, and that can be putting undue pressure on a certain part of their knee. And physiotherapists are very good at making sure that the alignment of the knee is as good as possible, that the muscles are as strong as possible so that areas like the kneecap are running true in the groove at the front of the knee to make sure that their symptoms can be minimised. I always encourage patients to get a new pair of shoes, and there's different designs of shoes these days that are more supportive and have more cushioning and make knee pain a lot more tolerable. The basic thinking should be that when you've failed non-operative management, when you've tried everything which doesn't include surgery, and if you're not happy, you then think about the risks and benefits that surgery could offer you. The older you get, your body does get weaker. So if you're thinking about the timing, a lot of people do start having knee replacements in their 50s. It becomes more common in your 60s. And it's not that we would say you're 65, you must wait for surgery to get to 70, but it's when you've actually failed non-operative management and that you think the benefits of surgery are worth the risks